Hello and welcome back to the Reflux Revolution podcast. I'm your host, Molly Pelletier, registered dietitian specializing in GERD, reflux, all things digestive health, as well as the founder of Flora Nutrition. In today's episode, we have a very special guest. We have Dr. Anna Catherine Black joining us, who is a licensed clinical health psychologist at GI Psychology. She specializes in the gut-brain connection and a mind-body approach to digestive health. She provides evidence-based treatment such as gut-directed hypnosis, cognitive behavioral therapy, and integrative health strategies for patients with gastrointestinal conditions. And we are going to be hearing from Dr. Black her top strategies for breaking the cycle of reflux anxiety, getting stuck in spiraling thoughts about future long-term consequences, and she's going to be answering some of our most challenging questions that we get from our clients and from our community, such as, what do I do if I fear I never will get better? Or how do I prevent myself from spiraling into scary thoughts about reflux or long-term damage? So we're really grateful for this episode. I know this is going to give you so many pragmatic, actionable takeaways to help you support your mind-gut connection and help you prevent reflux. Before we dive in, a quick disclaimer. This episode is intended for educational purposes only. It is not meant to diagnose, cure, or treat any medical condition, and it does not replace medical advice from a physician or personalized nutrition advice from a registered dietitian. Without further ado, let's dive into the episode. Dr. Black, thank you for being here.
Thank you for having me. I'm excited to be here.
For those who are new to the topic, can you start by explaining what the gut-brain connection really means and how it plays a role in reflux symptoms?
Absolutely. So the gut-brain connection refers to that constant two-way communication between our digestive system and our nervous system, or our gut and our brain. So interestingly, the gut has its own nervous system called the enteric nervous system, which is really sophisticated. It's actually sometimes called the little brain or the second brain. And the enteric nervous system talks to the central nervous system, which is our brain and our spinal cord, and it does this communicating through our vagus nerve. So it's like a two-way street back and forth. When it's working well, it's helpful. But when the signals between the gut and the brain get mixed up, the brain can start to misinterpret normal gut sensations as threats. And then that sets off this stress and worry, which then loop back to the digestive system and make symptoms like reflux or pain or bloating feel a lot more intense. So you've got stress and anxiety that also sends danger messages down to the gut, and that can start to change motility or acid secretion and sensitivity. So like in patients with reflux, that can make the esophagus more reactive. So even mild sensations can feel very strong, or very painful, even when there's not any danger that's present.
So true. Yeah. The hypersensitivity is something we definitely see a lot. And a lot of people think, reflux is just a physical issue. It could be their anatomy or our acid production, food, but we definitely find that the vagus nerve can play a big role. So how do our thoughts, emotions, and nervous system fit into the picture when it comes to this gut-brain connection?
Yeah, good question. So you're absolutely right. Reflux has its physical contributors like the lower esophageal sphincter, dietary triggers. But in terms of the mind and body, they don't really, like we talked about before, they don't operate in isolation. So when we're anxious, our muscles get tight and tense, and that also includes those muscles in the diaphragm and the esophagus. The body's fight or flight response can also increase stomach acid and slow digestion. And so on top of that, our brain's attention system can amplify these symptoms. So the more we monitor, the more we scan, the more we fear sensations, the stronger they often feel. Not because they're necessarily in the head, like maybe patients have heard that they're all in your head. It's not because of that. It's because the brain is prioritizing them as potential threats, as we talked about before. So the brain is also designed to interpret things very literally. So when we say things like, I can't take this anymore, or I'm in so much pain, I'm going to die, we don't actually mean that literally, but the brain interprets it literally. And then it flips on our fight or flight system, which contributes to more of those reflux symptoms and other GI symptoms in other patients.
Yes, it's so cool to hear you say this because I absolutely see this all the time in practice. And you mentioned like the fight or flight side of the nervous system, which is the opposite of the rest and digest side of the nervous system. And it's called that for a reason, because that's where our body can actually digest well when we're in that parasympathetic side of the nervous system. So you mentioned a couple effects of stress, like, slowing motility, sometimes increased acid production. But what else is happening in the body when anxiety and stress are making reflux worse for people, or they notice, okay, when I'm really anxious, my reflux is worse?
So when we feel anxious, our body activates that stress response. So there's cortisol, there's adrenaline that increases, the heart rate raises or rises, digestion actually slows, and the esophagus becomes more sensitive. So that can lead to more reflux episodes and stronger sensations, even with small, tiny amounts of acid. So it works kind of like a feedback loop. The anxiety worsens the symptoms, then the symptoms create more anxiety, and over time, that conditions our body to stay in that state of hypervigilance or that constant scanning. It's almost like our brain is on high alert all the time.
Yeah. Yeah, I think a lot of people listening can resonate with that. And I want to just like double click on the hypervigilance topic a little bit, because it's not often spoken about, but I think it happens in a lot of different GI conditions, especially reflux. How can this hypervigilance about symptoms actually cause or prolong reflux sensations?
So when we're constantly scanning the body for discomfort, the brain actually strengthens those neural pathways. So it's like turning up the volume on your brain's alarm system. Doesn't mean that the symptoms are not real or imaginary. It just means that the brain has learned to overprotect. So that's why therapies like gut directed hypnosis, CBT for GI, they help to retrain the nervous system to quiet down those false alarms so that the body can then settle. So yeah, you can think about it as definitely leading to not just causing the symptoms, but it can prolong the symptoms. So in some patients, it can be the precursor. For others, it's the symptoms already there, but when they're scanning, it actually amplifies that signal.
Yes. And I think that's like one of the biggest reasons that when we can lean into nervous system support and some of these GI psych modalities, we see that really pushing the needle for people and we see quicker remission of symptoms. So when someone feels that like burning tightness of reflux, how can they stop their thoughts from spiraling, especially when they've been through difficult flares before and there might be a lot of fear around these symptoms?
It's always important to first acknowledge the sensation without trying to judge the sensation. So what I mean by that is noticing that it's there without trying to change it, without trying to fix it. You just want to take more of a neutral approach. Maybe say something to yourself like, my body's reacting now, I can support it. And then shift from that catastrophic thinking, like, oh gosh, this is going to ruin my day, to more balanced thinking. Something like, I've experienced these sensations before and they're going to pass. What skill can I use right now to help my system calm down? Even that really small shift in mindset can lower the brain's alarm response and keep the body from escalating those symptoms.
I love those mindsets. Those are really, really important to keep in our back pocket. What are some ways people can begin to retrain their brain not to interpret every symptom as dangerous or permanent? This is something we spoke about in our group program when you came and spoke to my reflux relief group program, and they found it really valuable.
So we use a combination of exposure and cognitive restructuring. So you want to restructure or reframe the thinking, but also expose the patient or the person to what they're afraid of. So that this in combination that helps the brain relearn that internal sensations are actually safe. So in practice, that might look like gently focusing on the mild sensation, maybe even creating that sensation, doing certain activities to actually bring on certain types of sensations. And then you pair that with something like relaxation, slow breathing with a safety reappraisal. So in other words, that this sensation is safe. This is just reflux. This is not dangerous. That teaches the nervous system that discomfort doesn't equal danger, and it stops sending off that alarm bell. So over time, that rewires the brain's predictive model, reducing that hypersensitivity and improves resilience in patients.
And this is something that, certain books kind of reinforce this idea about reflux, that like reflux is damage, and also social media too, right? Like when people are selling products, they're talking about, okay, reflux is damage, you have to buy my product. Like, and it's scary on social media for a lot of people with reflux. And it's really important because so many people are dealing with this hypervigilance and this hyper awareness that when our brain makes the association reflux equals damage, now we're stuck in this really scary spiral that worsens the symptoms. So like breaking that connection of reflux does not equal damage because there's so much nuance here. It could be hypersensitivity. My symptoms might not correlate with when I'm having reflux. Like we have a lot of clients that get pH impedance testing, come back, and their symptoms might not correlate. They could be having reflux, but their symptoms might not correlate. So in that moment, thinking reflux equals damage, it just perpetuates like the symptoms. So I really think that's so important to like really remember, okay, symptoms do not equal damage.
Yes, yes, yes. And I have to tell patients that all the time, that when you're having that hypersensitivity, sometimes patients will say, well, I just don't understand. I'm in so much pain. How could this not be creating damage? How could this not be causing that? And that is because of that visceral hypersensitivity in the gut. The signal has been turned up so loud that it's distorted, it's magnified. It's like listening to your favorite song on a 10 rather than a 2. At a 2, it's nice, it's enjoyable, but at a 10, it's actually painful. And I have to tell patients that all the time. It doesn't actually, the amount of pain you're in doesn't always reflect what's going on in the body.
Exactly. And so this is why we have to break that association. I think some people listening, I don't want them to get the wrong idea that like I'm saying reflux doesn't ever cause damage. That's not what I'm saying. Like we know that there's the Barrett's diagnosis, there's certain things like reflux can, but making that association with every time you have a sensation is what we're talking about. And that gets into this feedback loop that can actually prolong symptoms. So having the right mindset about it is really important to get long-term relief. Just wanted to make that distinction because I know some people listening might be like, hey, that's actually not true. But we're talking about, the sensations really getting kind of attached there. So, and you mentioned, strategies. I think it's really important to talk about like pragmatic strategies for calming the body's stress response in the moment so that we can start to break these associations.
Yeah, so some of the ones that I go to, some of the ones that I teach are diaphragmatic breathing is one of the first things that I start off with patients. For those who don't know how to do diaphragmatic breathing, you're typically going to be breathing through the nose, like for a count of 4, and then breathing out through the mouth, either for a count of 6 or 8, whatever feels comfortable. I usually tell patients, it's go with what's comfortable to you, because what feels good to me, breathing in for a count of 4 may be my count, but for you, it may be not enough. So breathing in, the main thing is you want to make sure you're breathing out slowly and almost twice as long. So if you breathe in for 4, you want to breathe out for 8. But the main thing about diaphragmatic breathing is letting the stomach expand when you inhale like a balloon. And then when you exhale, you want the stomach to contract. So you're really getting everything out. That type of slow, deep breathing activates the vagus nerve and signals to the body that it's safe and it's okay to digest. Some other ones that I teach too are just some mindful grounding exercises. When you're starting to spiral, what are 5 things that you can see? What are 4 things that you can feel? For example, I can feel my watch on my wrist. I can feel the chair beneath me. Then do maybe 3 things that you can hear. This grounding brings you out of that fear and back to the present moment. So it stops sending that alarm bell to your brain and your gut to keep amplifying the sensation.
Love diaphragmatic breathing. We talk a lot about that with our clients and on the Flora app. And it also helps to strengthen the diaphragm. You mentioned the diaphragm earlier in this conversation, and the diaphragm actually is a really important part of your lower esophageal junction. When we strengthen our diaphragm, it actually has carryover effects to the lower esophageal sphincter. So diaphragmatic breathing is such a cool tool. I love that. And so we talked about kind of in the moment strategies. What about daily strategies that can help prevent the body from going into this like danger mode mentality?
So consistency matters more than perfection. Doing it daily, like you said, making sure that you're doing some type of that grounding that we were talking about, even just gentle movement, going for a walk, stretching. I imagine on your side of things, you're really saying regular meals, don't skip meals, making sure you're eating on a schedule, and then just giving that body that reassurance helps the nervous system feel safe. So even as you're mentioning, 1 minute of diaphragmatic breathing before a meal just signals to the brain that it's okay. It's time to digest now. And so over time, the body can learn to stay more in that rest and digest mode rather than fight or flight mode.
Love that. Yes, absolutely. With our clients, we are really advocating for this like daily practice, whether that's 1 minute of diaphragmatic breathing or using something on the Flora app. We really think that's consistency is the secret sauce, is what we always say.
Yeah.
There were two questions when you came and spoke to my reflux relief group program that I think would be really valuable to discuss. And one of them was how to get over intrusive thoughts about acid reflux causing long-term damage.
So what I typically tell my patients is you have to distinguish between possibility and probability. So yes, it's possible for reflux to cause damage, but when symptoms are managed, when they're monitored, when you've had tests that have showed there's no damage that's being done, it's not likely. So the goal isn't to really eliminate the intrusive thought, it's to change how you relate to it. So when that worry pops up, you may gently say to yourself, that's just my brain's alarm system talking. I don't have to believe it. I don't have to engage with it. And there's all kind of techniques that you can do. Mindfulness techniques, putting your thoughts on a leaf and watching it float down the stream, redirecting your attention elsewhere. Those grounding exercises that we just talked about, bringing your attention back to your breath or your surroundings, or even a calming activity. Over time, that retrains the brain to stop treating those thoughts as emergencies. It's just a thought. I don't have to listen to it. And also making sure that when the thought shows up, you're paying attention to what your brain is saying, or what you're saying to your brain, rather. Like we talked about, the brain's very literal. So if you're saying, this is causing damage, the brain's alarm system is going to flip on that sympathetic nervous system, and it's going to amplify everything. So you want to be careful with what the words that you use, because your brain is always listening.
Love that. So important. How does one get over the thought that they may never get better?
Yeah, so that's a common and really painful and scary thought that many, many patients have. It really comes from that feeling stuck or just exhausted by symptoms. Healing, especially when it comes to gut-brain conditions, it isn't linear. I wish it was, but there's going to be ups and downs. There's going to be plateaus. And I always prepare and try to let patients know that, like, or you're doing great now. Something may change, and that's okay. Let's talk about what we do when it does change. One helpful shift is moving from that very concrete certainty thinking, I'm never going to get better, to being more flexible with your thoughts. What if maybe this is just one chapter, not the whole story? A lot of times I tell patients, if you don't have hope, maybe feel reassured that I have hope. Maybe my provider is hopeful. My provider has showed me the research, and maybe that's enough for now. I don't necessarily have that hope yet, but I'm willing to say they believe, and so I'm willing to be open. Because when we have that small reframe, it helps the brain remain open to that possibility again, and that is huge. That openness is actually a key part of recovery, because when the mind believes change is possible, then the body can start to actually change as well.
That is in my second podcast episode, I think. I talked about how that was the key step in me finally getting better from reflux, putting my GERD in remission, was actually just believing I could get better and visualizing that. I think it's a really
really underrated, important step when it comes to healing. So I'm so glad you mentioned that. So how can someone shift from fear and frustration with their body towards a more compassionate relationship with their symptoms and body?
It's helpful to try viewing the symptoms as communication rather than punishment. A lot of times it's, what did I do? What am I doing wrong? What should I do differently? Rather, stopping to just think about the brain and the gut are just communicating. The body isn't actually attacking you. It's just signaling stress, fatigue, overload. And sometimes our body starts to scream at us when we don't take those breaks. We don't take that rest. So when people respond more with curiosity, with care, like taking rest. I actually just recently wrote a blog about how rest is treatment. It is not being lazy. It is important. Your body has to rest in order for that parasympathetic nervous system to get some use and know how to work. So breathing, reframing, resting, again, just sends that message to the nervous system that it is safe. And when we do that, our symptoms often start to soften.
I love that idea of rest, and a lot of people, including myself, experience digestive issues after a period of time where they may have been going 100 miles an hour, maybe burnt out, not resting, really like a lot of stress, or really, jam-packed schedule. And so that idea of rest is so, so valuable. And this concept too of like viewing symptoms as communication, as more information, is so helpful when we're reintroducing foods. So instead of being, thinking, oh, maybe, that bowl of tomato pasta like didn't feel as good, we don't have to view this as a failure. This is not a failure. There's just more information that your body right now, maybe didn't feel as amazing with that food. And there's going to be so many other foods that your body does feel well with. It's just more information of how to better take care of your body. So that mindset with food reintroduction is really, really key. For someone who's felt stuck in this anxiety reflux cycle we're talking about, what would be the most important step they should take right now in their healing journey, would you say?
The first step is probably to separate identity from illness. You are not your symptoms. You are not your reflux. From there, focusing on that nervous system regulation, learning how to soothe the body, even when the symptoms are there. Then once the body starts to feel safer, the gut can then begin to heal. And the things that you're doing with your dietitian, the things that you're doing with your medical providers, the CBT skills, the hypnosis are then a lot more effective when you do that.
Yes, I couldn't agree more. I've actually, had a lot of conversations with other GI dietitians that it's really challenging to be effective as a dietitian when someone their identity is intertwined with the issue they're facing. So trying to remove that is so important, and that's why we all often talk about, what are your interests? Like, what are your hobbies, your goals, and things, like to kind of remember the other parts of you, because sometimes we lose that.
Absolutely. That's great. I'm glad that you're giving that, you're telling patients that as well. That's awesome.
Awesome. Well, this has been extremely insightful and helpful, pragmatic. I'm so glad that you joined us on the podcast. For those who are wanting to learn more about GI Psych or connect with you, where can they find you in your work?
So you can learn more by going to our website at www.gipsychology.com. As I mentioned, we have lots of blogs, we have videos, both for patients and providers. We have handouts that talk a little bit more about the gut-brain axis, clinical hypnosis, CBT for GI. If you go to our website, you can schedule a free 15-minute phone consultation where a member of our team will just reach out, share a little bit more about the practice, get a little bit more information about you, talk about the treatments that we offer. And just a little bit more information, our admin team can be reached at admin@gipsychology.com, and our phone number is 703-910-2577.
Amazing. Dr. Black, thank you so much again.
Absolutely. Thank you for having me.
Before you go, you don't want to miss my free 14-day reflux reset program down below in the show notes. Make sure that you grab that, and make sure that you subscribe to this podcast. It really helps me continue to provide free resources to you to help you transform your health and prevent reflux. Give this episode a like or a 5-star review. From the bottom of my heart, thank you so much for being a part of this community, and I will see you in the next episode.